First, let's talk about something called the spiral of Tillot. This is a surgical landmark that helps you determine where approximately the retina is. You get that by looking at the insertions of the rectus muscles as well as the pupil. So, how do we get that? We follow what's called the 5, 6, 7, 8 rule. This refers to the fact that the distance from the medial rectus tendon to the outer border of the pupil, see over here, is about 5 millimeters long. The distance from the pupil to the inferior rectus is about 6 millimeters, to the lateral rectus 7, and superior rectus 8. If you can imagine drawing a circle like I've shown you over here, the circle that's bound by these muscles corresponds to the approximate location of the retina. This is quite important when you're doing certain surgeries, such as a vitrectomy. Now let's talk about the retina as you'd see it on an ophthalmoscope. That's that tool that the doctors use to shine light into your eye and then look at the retina. First of all, look at this magenta bit all around the border of your eye. That's what's called the ora serrata. What you'll notice is that towards the temporal side, here I've labeled temporal, medial. Towards the temporal side, the teeth, the so-called teeth of the ora serrata, are wider and flatter, as you can see here. Towards the medial side, you get narrower teeth and you get a lot more of them, as you can see here. The blood supply to the retina is via the ciliary artery. There are two of them. They run through the middle or the equator of the retina. I've drawn them in red. The blood, of course, provides oxygen and nutrients to the eye, and then once it drains into what's called the vortex veins. There are 4 of them, 1 in each quadrant. I've drawn them in blue here. The vortex veins at the top of the retina, the superior aspect, drain into the superior vortex vein. I've drawn that in a dotted blue line. The ones at the bottom drain into the inferior vortex vein. The nerve supply to the eye is via the ciliary nerve. I've drawn that in purple. It's right above the ciliary artery. And what's very important about this is that it's responsible for what's called the pupillary reflex. Now, if you've ever seen people who've just come out of the cinema into a very, very bright area, such as, well, the rest of the mall, you'll notice that their pupils rapidly shrink. They get very small. If the ciliary nerve is damaged, you will get a damaged pupillary reflex. In the clinic, you'll see a number of patients with a damaged pupillary reflex, and one of the things you want to consider is damage to the ciliary nerve. The final 2 things we'll talk about are the optic disc and the macula. The optic disc is drawn here in green. On an actual ophthalmoscope, it's going to show up as a waxy pale thing, so you might want to look that up, waxy pale circle. The macula, on the other hand, is in black because that's how it looks on an ophthalmoscope. It's actually a black fuzzy spot. The optic disc comes out of the eye as the optic nerve. And what's interesting about this is that it's responsible for what we call the blind spot of the eye. So if you can imagine, all of the retina is full of light detecting cells, rods and cones. We'll talk about those later. All of the retina, except for this optic disc. It's so full of nerves that there's no room for rods and cones. So light that comes in and strikes the optic disc will not be detected. Now, you don't see this normally because your brain fills out the missing spots using information from the rest of your eye and from the other eye, but in certain clinical tests, this becomes very important. The final thing we'll talk about is the macula, which is a black spot. In contrast to the optic disc, this is responsible for the most high-definition vision of the entire retina. Why is this? Because it's full of cells called cones. Cone cells have a very high resolution, so light that hits the macula is the most clearly perceived. This is what the macula looks like even closer. The macula is here on the outside, and in the middle you have something called the fovea. This is where, if you see a horizontal section, the macula looks like it's slightly depressed. It goes a bit lower. In the middle of that you have the FAZ. This stands for the foveal avascular zone, and like its name suggests, it does not have any blood vessels, just light detecting cells. In the middle of that you have the foveola, and in the middle of that you have the umbo. The umbo, it's the only part of the retina where you have all cones, no rods, here. If you imagine that in the rest of the retina you have a mixture of rods and cones, there are mostly rods outside here. In the rest of the macula you have a lot of cones, but you have some rods here and there. Right here in the umbo, you only have rods, you don't have any cones. So this is the most visually high resolution part of the retina. Now let's talk about the retina from a histologic perspective. There are three main layers of cells. I've drawn them in different colors as you can see here. The photoreceptor layer, the bipolar cell layer, and the ganglion cell layers up here. Down here we have the photoreceptors, and there's two types, rods and cones. Rod cells are good for a low light vision. Rod cells cannot perceive color, but they're very sensitive to light, making them ideal in very low light environments. Cone cells, on the other hand, detect color, that's a nice mnemonic, C for cone, C for color, and produce high resolution, very high quality images. I've drawn them over here at the bottom. The cone cells are, of course, these cone looking things, whereas the rod cells look more rectangular. At the very bottom, you have the retinal pigment epithelium. When light hits the retinal pigment epithelium, it changes the chemical conformation, and the cells detect these and then send signals to the nerve cells. Apart from the retinal pigment epithelium, there are multiple layers. The photoreceptor layer at the very bottom, at the outermost aspect of the retina, and above that you have the outer nuclear layer, where the nuclei of these cells are found. In the middle, you have what's called the ELM, or external limiting membrane. Above the photoreceptors, you get all of this stuff in green, the bipolar cells. Now, the function of the bipolar cells is to act as a sort of bridge between the photoreceptors, which detect light, and the ganglion cells up here, which send these signals to the nerves that go into your brain and then help you detect light. So, the bipolar cell layer are comprised of three layers, actually, four, depending on who you ask. The one at the bottom, the outer plexiform layer, contains synapses with the photoreceptors down here, and the one on the top, the inner plexiform layer, contains synapses with the ganglion cells. Just like the outer nuclear layer, you also have an inner nuclear layer, only this time it contains the nuclei of the bipolar cells. Now, depending on who you ask, there's also a layer in between the outer plexiform and inner nuclear layer called the MLM, the middle limiting membrane. However, this is rather contested. Some people say that it's an actual layer in and of itself, whereas others just prefer to see it as a part of the other layers. Apart from bipolar cells, you can also find things like amacrine cells, which help modulate the signals, but by and large, the most important cells in this layer are the bipolar cells. Finally, you end up with the ganglion cells, which are responsible for taking all of those signals from the other layers and then converting them into signals that get passed on to your brain. Unlike the other two layers, ganglion cells only get one layer to themselves. There's no plexiform, no nuclear layer, unlike these two. There's only one ganglion cell layer. The layer above that is called the nerve fiber layer. That's where all the ganglion cells sort of group up into nerve fibers, which run along the surface of the retina and then go out the eye via the optic disc. You can see that up here. I've represented the nerve as this big, long, magenta string passing across the top. And above that, just as we had an external limiting membrane, we also have an ILM, an internal limiting membrane. This is the innermost membrane of the retina. So, just to recap, you have three layers made up of three different cells. Photoreceptors down here, the bipolar cells, which take up everything here seen in green. You can see the names of the layers here. The ganglion cells, which are the innermost layer of the retina, and end up as nerve fibers that transmit signals out of the eye and to the brain.